Are you someone who is suffering from temporomandibular joint disorder? Then probably you will be experiencing something like some pain, unbearable pain in your jaw area. You wanted to open your mouth, but it is getting locked. You are hearing some clicking sound when you try to open your mouth. You cannot chew anymore. You cannot even think about having one chewing gum because it's going to cause you pain and you feel like something is clicking. If you want to understand what is really happening to you, this is the right video. Now let's try to understand what is really happening in temporal mandibular joint dysfunction. What is really happening to you? If you see this picture, there is temporal mandibular joint. So there is a joint between two bones, temporal bone and the mandible bone. If you want to actually understand what is happening with you, you need to understand you are a human body. Right. So what is this temporal mandibular joint? Where is this joint? This right here is the mandible and this right here is the temporal bone. This black color is the temporal bone. This is the mandible. Between them, there is one joint and that is temporal mandibular joint. The problem here happening to you is in the temporal mandibular joint. If you see in my body, this is the mandible and this is the temporal bone. This head area, this is the temporal area and this is the mandible. So between them, here if you touch, you can feel the joint, where you're experiencing pain. That is actually the temporal mandibular joint area. So what is happening in temporal mandibular joint disorder is that when you try to open your mouth, the first 10 degree will be a rotational movement happening in the temporal mandibular joint. So actually when you try to open the mouth, the first 10 degree of the mouth opening is actually a rotational, primary pure rotation in the condyles. So this thing is actually rotating here, the rotation of the this is rotation happening. After that rotation, normally what will happen is there is when you try to open wide opening of the mouth, there is an anterior translation happening. So this is the if you do this, when you open the mouth wide, after that 10 degree of rotation, then there is an anterior translation is happening. So if you want to understand, there should be some muscles working for this. So the first rotational component is actually done by muscles in this area. We call it as the suprahyoid muscle. Suprahyoid, there is one hyoid bone here above that muscle. This is the suprahyoid muscle and the infrahyoid. So the suprahyoid and infrahyoid muscle actually help in the rotational component of the mandible. So what they will do, they will compress the mandible. They will do this and they will help in the rotation. And there is another group of muscle which is I draw in the green color. That is trigoid muscles, the lateral trigoid muscle in this area, which actually help in the anterior translation. Two basic movements, rotation and translation. But the rotation should happen first, then should happen the anterior translation. But what happens in temporal mandibular disorders is this normal movement will reduce. The rotation will come down and the anterior translation overtake. More of the anterior translation, more work of this green muscle. The lateral trigoid muscle will work more than these muscles, the suprahyoid muscles. So the red color muscle is the red color muscle is the suprahyoid muscles. This blue bone right here is the hyoid bone. So these muscle action will reduce and these muscle action will increase. What happens in your dysfunction? There is an increased movement. The anterior translation of the mandible will happen more, and the rotation component of the mandible become less. And what happens if this happens? What happens? Because this movement between these joints, there is one disc that is actually here in the blue color. This blue color is the disc. So the disc is actually not supplied by any nerve. So even it getting compressed here, you won't get any pain. But behind the disc, there is one area. That part, if it gets compressed, there is pain. Now, if there's more anterior translation, see this trigoid, this green color, the green color that is the lateral trigoid muscle is actually attaching to the disc itself. So there's an overaction. There is an over translation happening. And if this happens, this disc can displaced out of this condyle area. If this disc get out of this condyle area, the back of the disc will come to the condyle area. And I told you behind the disc, there is actually an area where it's supplied by nerve. So that area will compress in this condyle and start getting pain. And that is the reason why you have jaw pain. That is the first sign. Next, you feel like something is clicking. The clicking is actually the disc actually slipped out of the condyle and is getting clicked every time you're trying to open. The main cause is increased anterior translation, the increased activity of lateral trichode muscle and decreased activity. The rotational component is reduced. The suprahyoid muscle is working is reduced. So these are some problem. You cannot bear the pain. Because this getting compressed, the painful area is getting compressed. The disc is getting locked. It cannot move anymore. It is out of the condyle. The disc is out, not here anymore. It is here somewhere. It's getting locked. This is the main problem. What is happening? If you address this problem, this anterior translation might come down. So once you address this problem, the basic biomechanics, you can now come and look at the translation part specifically. So what happens is you can actually ask the patient to hold and retract when try to open. So this is the mode of action what is happening. So what you can ask the patient? You can ask the patient to compress like this and open. So you will ask the patient to retract the mandible and this you can do. There's a lot of exercise, but the only thing is you need to see it as a complex, not just one single joint here. And the thing is, some studies have shown that the lateral trichode muscle activity is reduced in supine position. So if you want to try training this exercise, you can try giving in the supine position, because the action of the lateral trichode should be reduced here, because the anterior translation is more and the rotation is reduced. I hope this video helped. I hope someone understood what is temporomandibular joint disorder. And if you want to treat temporomandibular joint disorder, you need to treat and see the complex as a whole. The cervical posture, the thoracic posture, the range, the shoulder complex, the scapular complex. You need to see it as a whole. And these complex is what matters at the end in the temporomandibular joint.